Leukemia is a type of cancer that affects the blood or bone marrow. One type is Philadelphia chromosome positive chronic myeloid leukemia. Some patients with CML may have difficulty finding the treatment that's right for them. Almost 15% of CML patients discontinue their treatment in the first year due to side effects, so having different options is critical. Now, here to share her own experience being diagnosed with Philadelphia chromosome positive CML in chronic phase and how she found a treatment that worked for her is teacher and CML patient Jen. And here to talk about treating adults with CML is Dr. James Dugan. Good morning to both of you.
Good morning.
Good morning, James. Thank you very much.
Thank you for joining us. So, Doctor, explain what chronic myeloid leukemia is.
Yeah, allow me to give you a little bit of background. So chronic myeloid leukemia is a type of blood cancer, but more specifically, it's a disease of the white blood cells, which are part of your immune system. These white blood cells have a very specific mutation inside of them called the Philadelphia chromosome that causes them to divide and proliferate abnormally, becoming this cancer. Because of the Philadelphia chromosome, the disease itself is susceptible to a group of medicines called the tyrosine kinase inhibitors. And really, that's what we're here to discuss with you today. Through our partnership with Novartis, we are looking to increase people's awareness and education about CML and its variety of treatments.
Now, doctor, why is it important for CML patients to have a treatment option that offers both an efficacy and safety tolerability profile that works for them?
Yeah, the disease is chronic, and we're asking patients to live with this disease and its treatment potentially for the rest of their natural lives. A majority of patients that start a TKI will not reach the intended treatment milestones and will need to switch. And then, as you alluded to in the beginning, about 14% of patients will need to change their TKI due to side effects. So that's why it's important that they both have efficacy and tolerability if they're going to live with this for the rest of their lives.
Doctor, what are some important treatment options for adults with CML?
One of these medications, one of these TKIs, is Scemblix, also known as asciminib. This drug is approved to treat newly diagnosed and previously treated patients with Ph-positive CML in chronic phase, which is the most common presentation for CML. This particular medication has shown superior results in a recent clinical trial, pitting it against the standard of care, TKIs, at 48 weeks. This medication was able to establish some of those milestones that we're looking for, improved against the standard of care. Now, as we've alluded to, patients will have to take this medication long term, and there are side effects associated with each one of the TKIs, and they're very unique to each drug. For this particular drug, some of the common side effects are lowered blood counts, you can get high blood pressure, rash, GI upset. This is not an exhaustive list of the types of side effects, but certainly the more common ones that we see. For more information, patients can turn to learncml.com, or more importantly, they can turn to their physician to get the most updated information on CML and its treatments.
Jen, can you tell us about your journey with CML?
Sure. In 2014, I was diagnosed with CML. For the first 8.5 years of my journey, I tried 3 different treatments, and some of them didn't work. And the ones that I stayed on for the longest, I just had a really poor quality of life. And I had to quit my job, and my family had to take care of me. I was what you think of when you think of a cancer patient. I was miserable. And the idea that I would have to be like this the rest of my life was pretty daunting and totally humbling. And a few years ago, though, I found Scemblix, and it turned my life around. I'm able to work again. I'm able to take care of my family. I'm just able to be who I want to be, and it's finding the right treatment made all the difference in the world.
Jen, what advice would you give the 2 other adults diagnosed with this condition?
Be your own advocate. One of the reasons that I struggled so much in the first couple of years was I listened to my doctor. He had a fancy degree. He knew more than me. And so, what I thought my body was telling me was probably not right. And I allowed him to just sort of downplay my concerns. However, that led to a lot of poor side effects that I still have today. And so I found a new doctor who would actually listen to me. And not only that, he would like make decisions with me instead of just making decisions for me. And I'm just so grateful to have that doctor and to find a treatment that really works for me.
Dr. Dugan, what should adult patients with CML know?
Yeah, I'd like to just echo what Jen just said there. So in my practice at Novant Health, we're always trying to get people on the best medicine or the most innovative clinical trials. But more important than that is the relationship that we need to establish with patients. Patients need to be able to express themselves. They need to be able to tell you what they're feeling and how they're feeling it. We've already said that they're going to have to live with these medications and this disease. If that's the case, then we need drugs that are both efficacious, that work for the patients, but then are also tolerable. You know, we are capable with this disease because of the drugs that we have. We're capable of doing both things. We can get an efficacious drug, but then one that is tolerable that the patients can live with. For more information, patients can go to learncml.com, but more importantly, have this discussion with your physician. Find a drug that works for you.
Dr. Dugan, Jen, thank you so much for joining us on Morning Blend. Jen, it's been a couple of weeks since we've had Teacher Appreciation Week, but teacher appreciation to you, Jen, for the entire month of May. Got to hand it out to you.
Thank you.
You're welcome.
Thank you.
Thank you both for being on the show. Thank you again.
James, so thank you so much. Happy to be here.